So,
Thank you, George, for that gracious introduction. It's a delight to be here among friends from the Irish Academy, and to also have someone from the European Parliament. And I understand right now there are 105 people who have joined us from wherever they have joined us. Many wonderful things have been said about the SAPEA report, Transforming the Future of Aging, and I'm going to reiterate them. You saw just two glimpses of the wonderful participation or the contributions from Ireland. And as George said in his introduction, the Irish have not only contributed to the Transforming the Future of Aging report, but have contributed considerably to other reports. And we as Chief Science Advisors are delighted to see the eagerness to work with scientists who are very eager to have their results have a policy impact, a social impact, an impact on citizens. The report is an incredibly rich report. It touches on very many areas. We've seen two now. One was more closely linked to public health. The other was more closely linked to digital technologies. But there's an awful lot on housing, and there's an awful lot on older adult well-being. That's what's wonderful about the report. And what I also think is very important is that it enables policymakers at different levels to find very valuable sources of evidence for their work. So it's at the level of the local communities, the provinces, the member states, but also the European. Can we go to the next one? And that is where I come in, just to give you a little bit of background of, so we've heard the acronym SAPEA. I'm going to introduce a new acronym, that's GCSA. The group of Chief Science Advisors in Europe, and just a quick overview of who we are. It's a very diverse group in terms of North, East, South, and Western Europe. You will see now that women are actually overrepresented among the 7. You will see that we also represent very different disciplines, material sciences, chemistry, biology, physics, political sciences, so I'm not the only social scientist anymore, and genetics. May I have the next slide? Given the richness of the report, and given that when it was presented to us, that was last year, October, that was the time when the new commission was coming. And we wanted to capitalize on the ideas that the new commission would have and see in what ways the wealth, the richness of the report could be brought to the attention of the commission. And that is why we wrote a letter to Commissioner Gabriel, Maria Gabriel. She is the Commissioner of Research and Innovation and Sports and some other things, and I forget about it, but she is our immediate entry point into the commission. And we, in that letter, and it's only 2 pages, summarized key elements from the SAPEA review report. And we described their relevance for the planned green paper on aging. We drew attention to its relevance for von der Leyen's political guidelines on equality. We drew attention to the relevance for the implementation of the European Social Pillar, and I'll go into details in a minute. And we also pointed to the relevance for the European semester process. And yes, that was in February, then came COVID, but I can now tell you, and what we did in our letter was also that we offered to discuss the findings, not just we 7, but particularly the authors of the report, in preparation of the green paper. and I can tell you now that a meeting is planned for the 18th of September. So progress has not been quick, but at least now we're getting the first steps where we can actually start working on finding how the evidence review can help inform European policymaking. The next one, please. What are those key elements? And I'm repeating a little bit of what Roseanne said and what what Richard said. The necessity of health promotion and disease prevention. Another important issue is also the recognition of social factors, ageism, but also poverty, poor housing, that negatively affect later life well-being. Something that Richard stressed, the importance of training healthcare professionals in the use of technological innovations. Of course, that's where it ties up with major European efforts to better educate and better train the European workforce. We also pointed to the necessity to introduce safety and security standards for wearable and home care technologies. Richard already discussed that. We emphasized the importance of digitizing and securely sharing healthcare data. And yes, we emphasized the urgent need for adequate numbers of skilled healthcare professionals. And these are nuggets that are from the Transforming the Future of Aging report. The next slide, please. I took this from the European Commission website. Originally, the Green Paper in Aging was supposed to be finished in, or the first report, so that's the impacts of demographic change. It was supposed to be finished in March, but it wasn't adopted until the 7th of June, so there's a delay. The next step is to start work on the Green Paper on Aging, and that's where one of the very first activities, and that's a recognition of this work, will be a meeting with the GCSA, so that's the Chief Science Advisors, with representatives from SAPEA. That's encouraging. Next slide, please. How are we trying to translate the findings from the Transforming the Future of Aging report so that the Commission has hanging points? One of them is this issue of equality. Commissioner von der Leyen is very eager to reduce inequalities between North and South and East and West. And we all know about long-term care and how differentially it's organized across Europe. So this is a way we talk about inequality and then make the step towards the very wide differences in the organization of long-term care. And I'm not talking about finances, I'm not even talking about the quality. She also talks in her political guidelines about inequality between women and men. And then we come into late life well-being, but we also come into the workforce, those who, it's still women who predominantly provide care and as a result have greater difficulty participating in the labor market. And she's very eager to reduce disparities between young and old. And I'm aware that the report adopts a life course approach. So it's also, that's what's so wonderful about the report, that it says if you want to know something about older adults, you also have to look at the earlier life phase. But in terms of equality, we have not been able to get the attention of the Commission and to then introduce elements from the Transforming the Future of Aging report. Next slide, please. The European Social Pillar, it lists 20 core basic social rights. And one of them is, and I'm reading from the screen, access to affordable long-term care services of good quality, in particular home care and community-based care. And Again, work on implementing the social pillar. There's a group now called the Inter-Service Group, which was initiated by what we call the unit in Brussels. So the people who are supporting us, they work with 24 commission services. One of them, or at least there they have brought to the attention the necessity of implementing the European social pillar and to introducing the issue of access to long-term care there. Next slide. The European semester process. This is an annual report of the member states to the European Commission on financing, on social security, on sustainability. And this is an opportunity for from the European Commission, and this is what we would hope to achieve, is to include among the need, the reporting, monitoring, benchmarking, and exchange of best practices in terms of, and then I've got the list here, access to long-term care, the position of men and women in the labor market, the promotion of healthy aging, postponing and coping with cognitive decline, and the co-creation of technological devices. The idea here is that if reporting on these issues can become part of the European semester process, it's again a way for countries to start realizing where they stand in terms of the exchange of best practices, for example, or in terms of benchmarking. And here I think, and that's something that's nice in the report, we can turn to the work of the UNECE Active Aging Index, because it already has a lot of the benchmarking. And so we can say, hey, academic community already has these indicators, and the next step would be to have these indicators part of the European semester process. Next slide. Oh, I'm repeating myself here, but there's a clear role on the one hand for the European Protection Committee, the Social Protection Committee, which relies heavily on reports that are produced by academics. And as I mentioned, there's also the use of aging knowledge platforms, and one of them is the Active Aging Index. Next slide. Next slide. This week, so it was the 2nd of September, we had an informal meeting with Commissioner Gabriel, and these informal meetings are very pleasant because then you can be a little bit, you can talk more openly. And what became apparent there is that Commissioner Gabriel sees transforming the future of aging as very high on the agenda of the Commission. And what she talked about, one was in connection with the quality assessment of national health systems. A second was the issue of inclusiveness, and there comes in the protection of vulnerable groups. And yes, the third was improving the skills and the level of education of the general workforce, which of course then ties in to all of the important bits of evidence that are in the report on digital technologies. Next slide. I think this is my last slide, yes. So the report is rich, and the richness means that it will feed into various policy domains, and we are doing our best to find ways to bring the importance of the wonderful evidence review to the attention of the European Commission. Thank you.